Welcome everybody, and a special welcome to Jack and Kathleen Eck. Thank you for joining us tonight. I am Michael Holton. I'm the Chief Marketing and Experience Officer here at Vail Health.
Good evening. I'm Dan Pennington, President of the Vail Health Foundation. Unfortunately, COVID-19 has altered our event plans for the whole of 2020. While we can't physically gather in large groups, we have a very special evening planned, and we will celebrate together, just virtually. Tonight, you will hear from Will Cook, our President and CEO, who will share updates on Vail Health. Chris Lindley, our Chief Population Health Officer and Executive Director of Eagle Valley Behavioral Health, who will provide a behavioral health update. And we will celebrate Dr. Jack Eck's long legacy in the Valley and his retirement from the Vail Health Foundation on December 31st. You can send comments for Jack using the Submit Comments button at the top left of the screen. Now I'll turn it over to Michael.
So make sure you grab a drink of some sort for some toast later tonight and hang with us through any technical difficulties, knowing we are doing our best tonight. Tonight, we're celebrating the legend, Dr. Jack Eck, whose legacy has touched so many of us here in the Vail Valley and beyond. As many people know, Jack was among the first physicians in Vail. And after Vietnam, Jack couldn't think of a better place to heal his soul and to help others. In fact, his experience as a Vietnam combat flight surgeon helped shape healthcare here in our valley, including pioneering ski patrol trainings and life-saving techniques that have become best practice across the ski industry. He's had a remarkable career, and it seemed like Jack was everyone's doctor. Dan, I remember in 2015, we were about to celebrate the 50th anniversary of Vail Valley Medical Center, and we had a vision for a video that we wanted to make. It started with a flyover the back bowls of Vail at sunrise, and then an iconic voice comes in and says, "For the last 50 years, the Vail Valley Medical Center has cared for people from around the world. Hello, I'm..."
James Earl Jones?
This is the ski industry, Dan. This is an iconic ski voice that we wanted.
I see.
So I went into Jack's office and I said, "Jack, we got this idea, we got this vision, and I need you to fly a plane over Vail Mountain, and then we're gonna have Warren Miller's voice come in, and we're gonna have him say this line." And Jack's eyes lit up and he said, "Warren Miller?" And he opens his desk, and I kid you not, he pulls out a framed photograph of Warren Miller, and it says, "You're doing great, Jack. Let me know if you need anything for the hospital." 2 days later, we were talking to Warren Miller and his wife and had him record this in the middle of him writing his memoirs. And Warren Miller did the introduction for our 50th anniversary video, because Jack Eck was everybody's doctor. Let's hear from a few of his patients in this video.
Well, hello, darling. And you know what? I'm so honored to be here and be asked to speak today and to help you celebrate your retirement. And I have to say, I'm sorry that we have it this way, because I would rather be on the dance floor with you and dance a storm off. But anyway, that's the way it goes. And I just want to tell you how much Peppy and I loved you, and the memories we shared are unbelievable. I'm going to write a book just about our memories, okay?
Jack has a real concern for people, certainly his patients, but just people in general. When you're with him, you're the most important person there, and he projects that very well, and it's sincere.
The key thing about Jack was he didn't have an ego involvement. If he could refer you to another physician or to another place where you could get better help, Jack did that right away. He never held a patient back simply because he wanted to control where the patient was going.
He didn't make an opinion, but he synthesized what you said. He had a mental Rolodex that he drew from in Denver or any place in the US as to where you could be best served.
You have always been a legend to me, Jack. Since I was a little boy, I remember your name being spoken with respect and almost reverence in our home. My parents, Moose and Ann Taylor, were kept in good health for many years as you came up to their house in the mountain to diagnose and treat their medical needs. You were the go-to guy whose phone number was kept close at hand.
Jack was just our doctor, and he treated me for various things. But he's always been there, you know. If you have a problem, you could call him up, and he'd always answer the call.
Jack was very instrumental with getting doctors because he was friends with all of them in Denver and everywhere. And he really attracted a lot of people in the medical field to come here.
You know, everybody has a touch, and of all the doctors I've ever met, I think Jack had the softest touch. I think he became everybody's friend after anyone would meet Jack at medical treatment or just get to know him socially. I never met anybody that didn't have something nice to say about Jack.
You care tremendously about all patients. You care tremendously about the community. And I've also learned over the years that your love for the Vail Valley is just ungodly to even fathom how much you are loved and how much you're respected in the Vail community.
You know, Jack, with your medical practice, you've kept the shiny side up, and I've really appreciated that. But more so, I just appreciate your friendship and kindness, and look forward to being around with you many more years.
Having practiced medicine for many years here in Vail, one of the things that was really difficult to take care of were people who are having behavioral health issues. And with the new behavioral health approach to life here, we realized how many cases were missed, how many lives were lost, how many lives could have been enhanced, all because we just didn't have the resources or the expertise with the resources that make it happen.
And how lucky we are that Vail Health has taken the lead.
Oh, yes.
In really consolidating and bringing together all of these resources to help the community.
How many communities in the whole wide world really has this resource? I can't think of any. We are so lucky.
Jack continues to be a tremendous advocate for behavioral health. As he mentioned, Vail Health has taken the lead in transforming behavioral health in our community. Exactly 1 year ago, we launched the It Takes a Valley campaign to raise $100 million for behavioral health. To date, we've raised $26.2 million for EVBH and our community partners. At this time, I'd like to turn it over to Chris Lindley, our expert on behavioral health, so he can tell you everything EVBH has accomplished under his leadership, which I find astounding. Chris?
Officer for Vail Health, as well as the Executive Director of Eagle Valley Behavioral Health. And while this has been a very challenging year for all of us with COVID-19, I'm really excited to have an opportunity here tonight to tell you how we're doing in 8 of our key initiatives. But before I do that, I have to recognize Jack myself. I know everybody's recognizing Jack, but honestly, I don't think I would be here tonight, and we certainly wouldn't be this far along with behavioral health if it wasn't for Jack. When I first moved here to the Vail Valley back in late summer of 2017, we knew immediately we had a problem within this county related to behavioral health. Suicides were off the chart. Substance abuse was as high as anywhere in the United States, and there was a severe shortage of behavioral health resources. So we talked with the Eagle County commissioners, and we convinced them to run the first ever marijuana tax to raise money specifically for mental health. And as we looked at 60 days out from voting day, we realized in order to pull this off, we needed to have a champion. We needed to have a medical provider that everybody trusted. And so when I went to the county commissioners and I asked them and my friends in the Valley, who is the Valley's doctor? Who is the most trusted, looked at physician in the whole community? Everybody said Dr. Jack Eck. I did not know Dr. Jack Eck. I'd never met with him. I picked up the phone that day. I was able to get a hold of Jack, and he said, "Hey, partner, what can I do for you?" And from that moment, he immediately stepped up using his great reputation, his name, and his calming voice, and he helped us pass the first ever tax on marijuana to support behavioral health. And so, Jack, I want to also thank you for your leadership early on to get us to where we're at today. And I'm happy to report of 8 of our initiatives today. So the first one that I know all of you are very excited about, and that's our behavioral health facility. Just over 2 years ago, Vail Health actually purchased land here mid-valley in the Edwards area on the North Star campus to one day be a future medical campus with the hopes of having a behavioral health facility. Today, I'm happy to report we're now moving down that process. We actually have our plans in place that are now in front of the Eagle County Commissioners. We're going through what's called a PUD process, which is really just a land use approval to get us approval to build a future behavioral health facility. Hopefully in the next 2 years, we'll have a 14-bed inpatient facility with beds for both adolescents and adults. And we're really excited to bring that here mid-valley and have that care available to all 24/7. The second thing that we've worked really hard over the last year, I mentioned when 2 years ago, we were lacking on provider access. In fact, when we ran the numbers, what we found out that here in the Eagle River Valley, we had half on a per capita basis of the behavioral health providers related to the state of Colorado. And the state of Colorado was 48th in the country. So we were losing the race of losers at the time. Today, we've actually brought on an additional 50 behavioral health providers. They're not all therapists. Some of our behavioral health navigators, some of them work with individuals trying to link them up with insurance and support process. But 50 new behavioral health providers have joined our community in the last 12 months and has made a huge impact as we go forward. The third objective we've been working on is system coordination, and that's really the work of Eagle Valley Behavioral Health. But when you think of the work we're doing, we as a group, Eagle Valley Behavioral Health, is not doing the work day to day. The work is actually being done by 56 partners throughout the entire valley. And these partners are everything from nonprofits to actual behavioral health entities like Mind Springs, Colorado Mountain Medical, our first responders leadership, and all the police department, the chiefs of police are all involved, the Eagle County School District, local businesses, etc. So the great work with all that over this last year, there's actually been 56 entities that have received funding from Eagle Valley Behavioral Health to carry out the great work that we'll be talking about. The fourth one, and definitely not the least important, is prevention and education. We know ultimately if we're ever going to win the battle with behavioral health, we have to move upstream, or another way to say is we have to actually prevent the illness and we have to identify it early. So we've invested over 40% of our dollars in the first year in prevention and education. Today in our school district, at every single grade level, there's social emotional learning curriculum for every kid going through our school system. We also have a robust anti-stigma campaign that you'll see throughout the valley. You might see our billboards, our buses, etc. Bottom line is in the last year, we took what was a taboo to speak about, behavioral health, mental health, and now it's the norm. People are talking about their issues. People are talking about their problems. Much like they might talk about a ski injury, they're now talking about issues they might have with drinking or substance abuse or anxiety or depression. And in the times of COVID, when every single one of us has been affected by the anxiety and the stress and the loneliness, it's been really rewarding to see everybody talking about it as a community. And I think that's one of the reasons why we are doing so well in this valley as we go forward. The next one is crisis response. The Hope Center, we've been able to bring the Hope Center, which was an idea on the Roaring Fork Valley, over here to the Eagle River Valley. And in just the first year, we've reduced transportations to our emergency department by 74%. 74%. We're now providing care in people's homes or wherever they might call needing help. So every time you call 911 in this valley, if you have a behavioral health emergency, you're going to be greeted and cared for by a behavioral health provider at your location of call versus what was previously happening, which was a transport to our emergency department or county jail. The sixth initiative is our school-based services. Also very excited to report in every single grade level, elementary, middle school, and high school, we now have licensed behavioral health providers in our schools. As of the end of this year, we had 15 in place. We're hoping to grow that another 5 over this next year, but we're the only school district in America that has behavioral health providers that are non-Eagle County School District staff working independently, providing care for our kids when they need it. The seventh one is innovation, and we've worked really hard on innovation. One of the things we've looked at is how do we take care of our own Vail Health employees and all the Vail Health family. We've started what's called an EAP, which stands for Employee Assistance Program. And what that is, if anybody in our organization is having any issues with behavioral health, and again, that's substance abuse, mental health, or anybody in their family, we actually line them up with providers here in this valley. And over the last year, from when we started with about 2 to 3% of our employees actually seeking help and care. Today, just today when we ran the report, it's over 15% over the last year of our employees have reached out and got the care that they need. And the last and not least is business line oversight. And I want to talk about this really briefly because this is the true power of the Vail Health system, the entire system from prevention, intervention. We now have Colorado Mount Medical as part of Vail Health. And within that, over this last year, we've added 13 providers. And in 2 weeks, we're going to have the first psychiatrist start us. She's a double board certified psychiatrist, both in adolescents and adults, as well as a new nurse practitioner. Dan, I can go on all night. As you know, I get really excited about this, but I better turn it over to you.
Thanks, Chris, and to the whole EVBH team for their great work during this first year. But this is just the beginning. We have a long way to go. For those of you who've donated to EVBH and our community partners, thank you. We will need the support of the entire community to ensure our long-term success. And now back to tonight's honoree. Jack has been honored with many awards throughout the years. In 2008, Jack was awarded the Citizen of the Year by Vail Valley Foundation, and in 2015, he was inducted into the Colorado Snow Sports Hall of Fame. We have a special guest to present Jack with a new award tonight, Vail Police Chief Dwight Henniger.
One of Vail Health's medical pioneers, Dr. Eck was instrumental in setting up the hospital's first ICU, creating the Vail and Beaver Creek Ski Patrol's medical training program, and having the Shaw Regional Cancer Center built in Edwards. A true living legend among our community and beyond, we are honored to present Dr. Frederick Jack Eck with this Distinguished Service Award. It's really a pleasure to be able to recognize Dr. Jack Eck with the Eagle County Public Safety Award for Distinguished Service. This is a partnership between the Public Safety Council, the 3 Rotary Clubs of Eagle County, and Starting Hearts. And we're so excited to be able to give Jack this award.
Congratulations, Jack, on this well-deserved award. We all know Jack as a wonderful and caring doctor, but tonight we're celebrating Jack's work at the Vail Health Foundation. The foundation owes much of its success to him. Here's a short video about Jack's leadership in philanthropy.
As chairman of the board of the hospital, we were going through a time of transition. Once we kind of got things straightened out, we had to move towards philanthropy. There was nobody within the community that was better respected than Jack Eck. He was a logical person to go out and to try to foster the relationships that he had built over a long period of time to really support the needs of the hospital and our community.
The relationship with Howard Shaw is really quite unique. So one of these days he was sitting in the office and telling me he wasn't feeling well, but he said, well, can we do something for these cancer patients? I said, well, gee, to start a cancer, it's going to be pretty expensive. He said, how much would it cost? I said, it's going to be about $17 or $18 million. And I was just shuddering, just bringing something that large. He looks up, he says, Jack, I think we're going to do it. I didn't know what to say. I stuttered, I stammered, because I'd never really asked many people for money before. And the rest is history.
As the cancer center was growing, it became aware to us on the board that there were people sleeping in cars, and there were people coming from remote communities that just did not have the resources to be able to deal with this dreadful disease. That was the genesis of Jack's Place.
Dr. Hardenberg was a tremendous partner. We and this group formed, this small group.
Susie got 6 of us together and said, let's meet for lunch once a week.
Ann Smead always says that's the most expensive lunch she's ever had.
And we would, and Patty would come talk about what was happening at the Shaw. We'll never forget the time when she came and said, there's a man who's going to sleep in his car for his 8 weeks of radiation treatment. And
it was February.
It was cold.
Yeah,
and
so that's when we knew that the housing had to be a priority.
Yeah.
What these folks did, these wonderful women, they decided they're going to look around the country and get some ideas. And on their own nickel, they traveled all around the country looking what they wanted to do, have a place for people to stay. They could, do their own kitchen stuff. They would be close in, and they would be healing at a certain level.
We sent out a letter to, I can't remember how many people, a group
But
of
we
people,
knew
but we knew everyone. We didn't make any follow-up calls, and we raised $180,000. And we all said, well, if we can do that without any follow-up, maybe we ought to shoot a little higher. And that's when the house was actually the germ of an idea and then reality.
Jack was right there. Jack was on board, and he was the presence that gave us the advice as to what we needed, how we could go about it. We did it in, I think it was 12 months, from start to finish, money raised, and 12 rooms built.
Everyone decided they're going to have a big celebration, so we went out to the Donahue's house that night. There's a picture of everyone going up these big wide staircases they had. It was just packed full of people. So someone said, oh, you hold this banner, you hold this, and the banner was between. I said, Jack, come over here, and why don't you hold this in and someone hold that? I said, fine, I'm looking here. And as everyone starts looking around, all of a sudden they turn and look at me. No one said a word. So I said, Jack, what does it say on the front of that banner? I looked, and it said Jack's Place. And I about died. I had no idea.
Jack has been an inspiration for so many to get involved in the community and to stay involved in the community. And Jack has obviously done so much to create the healthcare system that exists in our community. With his initial involvement with Vail Biomedical Center and Vail Health now and the Vail Health Foundation, he has truly transformed the way we have access to and receive care in our community.
He's a good guy that you don't mind giving money to because you know it's going to be well spent.
I mean, one of the great things about philanthropy with Vail Health is that you can see the tangible results. You can see the programs coming alive. You can see the building coming alive. And it's so rewarding in a community that you call home.
I really enjoy still being involved and being part of the involvement. I enjoy educating folks in other communities about what we have here and our accomplishments and what we built here over the years, because I'm really proud of what's just going on here.
Many of you know Jack is a kind and compassionate physician. But what people don't realize, and probably Jack didn't realize when he went to medical school, he's also an accomplished fundraiser. Over his career, Jack has helped raise a tremendous amount of money to benefit Vail Health. A number of years ago, the hospital was going to be remodeling hospital rooms. This was before the master facility plan expansion that we've just completed. Jack was working at the foundation, and he and the team there started a mini campaign to raise money for this remodel project. In exchange for a generous gift, benefactors would be allowed to put their name on a hospital room. One of the things that's made this room naming campaign successful is that people enjoy seeing the names of people they recognize or have heard stories about when they come to the hospital to visit loved ones. We've even had people ask if they could stay in their room when they come for a scheduled surgery. As the Vail Health Foundation staff thought about how to recognize Dr. Jack Eck in his retirement, we realized there was one very important name missing from the hospital room naming project. We reached out to many of you to help us with that, and we weren't surprised at all by the overwhelming response. Jack, we couldn't think of a better way to honor you than putting a plaque with your name on it here in the hospital, on the patient care floor where you've taken care of countless patients and families. We couldn't be more proud of the work that you've done on behalf of Vail Health over your career. Thank you, Jack.
As you can see, Jack started us on a path to success, from our humble beginnings to today's renovated and expanded Vail Health Hospital. Let's take a look at the next video. Jack has been a leader in fundraising at Vail Health over the years and has helped develop a deep and lasting culture of philanthropy. The fact that we are gathering here tonight on December 28th is part of a long-standing tradition in philanthropy for Vail Health. On this date, almost 40 years ago, the first family dinner dance was held to support Vail Valley Medical Center. The dinner dance was held for over 35 years on this same night each year, December 28th. This is the date of Thelma Britton's birthday. Gordon and Thelma Britton moved to Vail in 1965, when there was not a hospital to care for this community's residents. The Brittons dedicated themselves, working alongside Jack and many others, to make sure Vail would have quality medical care right here in the community. Gordon and Thelma's portraits now hang across from the history wall and the new benefactor recognition display. This location is the perfect place to recognize these important philanthropists. The legacy that Gordon and Thelma Britton started is being carried on through the recent gift from their son Kent and his wife Charlotte. They have generously supported our new speech therapy program, which will launch in mid-2021. We are fortunate to have many families here in the Valley that have generously contributed to the hospital over the years. When we first broke ground on the master facility plan back in 2015, the entry and lobby on the hospital's west side were expanded and remodeled. The footprint of the Howard Head Sports Medicine Clinic increased significantly. We added a fourth floor to the west wing and made improvements to our pre- and post-op surgical areas. We added new hospital rooms on the patient care unit and expanded our intensive care unit. One of the major achievements during this time was the opening of the Precourt Family Cardiac Catheterization and Electrophysiology Lab. The West Wing will connect to our new East Wing through the Heartland and Mackey Family Foundation atrium. When we broke ground on this phase in 2017, no one could have imagined how beautiful it would be. No one but Mike Shannon, that is. Mike's leadership in this project has been unparalleled, and we are grateful for the vision he had for this beautiful new facility. The entrance to our expanded Borgen Family Emergency Department and Trauma Center is right next to the hospital's main entrance, making it easy for patients to access the medical care they need here in Vail. We are grateful to you, the many families and individuals who supported this project and helped us build this amazing new facility for our community. Thank you.
When my wife Kelly and I moved here 16 years ago, Kathleen helped us buy our first house, and we still live there, Kathleen, thank you. And about 10 years ago, I left the ski industry to join Vail Health, and getting to work closely with Jack played a huge role in that decision. At that time, Jack was the foundation, and the strategy was simply ask Jack's friends for money. Then 5 years ago, the master recruiter, Mike Shannon, brought in the fundraising robot, Dan Pennington, and his first job was to raise $75 million. The strategy was
ask Jack's friends for money.
And it worked. They launched together the Campaign for a Healthy Active Tomorrow. And it was the largest fundraising campaign in our community at the time. Not only did they raise $75 million, they raised $107 million. Huge thanks to the many benefactors who contributed. And kudos to Dan and an incredible team that he has built here at the foundation. I'd like to introduce an incredible man, our new Vail Health president, my friend and CEO, Will Cook, to talk about Vail Health's new East Wing and our exciting future projects.
Thank you, Michael, and happy holidays, everyone. The holidays is a time for giving and for being thankful. And we are very thankful to our benefactors, because without your support, many of these dreams couldn't become a reality. We're also very grateful for our frontline staff and providers, and the staff behind the scenes, who've not only helped us navigate COVID, but carry out the strategic initiatives that you're going to hear about tonight. None of this could happen without an incredibly visionary board and a management team that's willing to work the hours to make it come to fruition. So we're so grateful tonight for so many people on the front lines and behind the scenes who make everything come true. I also would like to talk to you a little bit about some of the strategic initiatives that are taking place here at Vail Health. You've already heard Chris talk about behavioral health and all that Eagle Valley Behavioral Health is doing. You've seen a video now of our master facility plan that culminated here in the opening of the East Wing. All of that took many years of planning and all sorts of execution. I'm excited to tell you a little bit now about some of the other things that we're doing as well, including growth in Summit County, where we're building a new facility in Dillon. It'll have an ambulatory surgery center, an urgent care center, comprehensive cancer, primary care, and we look forward to bringing some of this world-class care to our neighboring valleys, including the Roaring Fork Valley, where we will also be building an ambulatory surgery center with partners like Stedman Clinic and Aspen Valley Hospital. We're also focusing on how we can do a better job of managing the population's health. How do we get upstream to diseases? How do we focus on prevention? Try and help people who have needs to be met without having barriers like access to affordable care. We're trying to be better community partners in all that we do, working with our local municipal governments, our state governments, our federal government, on ways that we can not only be a destination for orthopedic care, but also a place where people receive primary care and chronic disease management, leveraging our capabilities in cardiology, focusing on everything that we do about being the best quality care that can be provided. Again, none of this happens without a board that's incredibly supportive. So on behalf of our current board and our board chairman, Eric Affelt, I'm proud to introduce you tonight and turn the mic over to Mike Shannon and his wonderful family.
Thank you, Will. We're here to talk about Jack Eck, a Colorado original. Jack's a man of many firsts, a real trailblazer. But first and foremost, Jack, you're a compassionate, caring man with a gift for listening and caring for your friends and patients. Our family has been the beneficiary of 3 generations of care from you, and now an advisor on Carrie's newest generation, number 4. Carrie and I had the privilege to also work beside you at Vail Health. And I'll tell you, your bedside manner and your workside manner are identical. Smiling, engaged, interesting, and highly effective.
Congratulations, Jack. It was a privilege to work with you and learn from you and get to hear firsthand some of the stories from your legendary career. Thank you for everything you've done for this community and for our family.
Hi, Jack. It's hard to believe it was 35 years ago when our family started walking through the Red Brick Clinic with our family. We will always treasure our time with you. Our visits to Black Lake with friends and will stand out in our memory as highlights. Thank you so much for all you do.
Jack, you're not just our first family physician, you're also a first for so many, many things in Vail. Many here tonight know that you were the first physician to serve on ski patrol, but they didn't know you were the proverbial Jack of all trades. You have expertise in internal medicine, cardiology, hematology, and even some of the challenging times in your life. The PTSD you gained from Vietnam experience gave you an incredible, deep insight into our physical health and how it needed to be integrally related to our emotional health. Your expertise and inspiration played a very, very large role in filling the Valley's biggest unmet need, a coordinated first-class mental health system, one of your great triumphs. You're also a great visionary. You were the first to see that there was a comprehensive need for medical training by ski patrol to help our skiers stay safe and be safe. You were the first to see that we needed a comprehensive cancer center in this valley. Today we have Shaw and Jack's Place as sterling examples of your vision. You were the first to see that we needed a full-time cardiac cath lab here in Vail. Thanks to the generosity of the Precourts and many of your friends, we now have that. For a long time, for decades in the high altitude areas, the mantra was that it was too high in altitude here in places like Colorado in the mountains to conduct heart procedures. So your only choice was simply beta blockers and drugs. And for over a decade, Vail would helicopter would deliver patients, hundreds of them, over a decade to Jerry Greenberg in Denver, risking the critical 1 and 2 hour window necessary to keep people alive. But you changed that, Jack. You convinced Jerry to come here. Jerry only had one thing. He needed a $10 million cardiac cath lab to run 24/7. And you made that a reality too. Your mission to reduce what is called sled time to balloon time, reducing that time from the time you're in the back bowls to the balloon time where a cardiac catheter opens up the vital organs in your body, is now a great skill metric used around the world in skiing. Sled time to balloon time. How low can it be to save lives? Jack, you've saved dozens and dozens in just the last couple of years. Jack, you were also the first to believe that Vail didn't need to be a medical farm team for Denver. You embraced and helped recruit expansion of orthopedic trauma experts in many, many other specialties. We thank you for that. The vision of great health right here in our backyard, that was your vision, and that led you to be the natural choice to chair the Vail Health campaign and help complete $300 million of incredible facilities here at Vail that will serve the next couple of generations to work. Your vision of making Vail a medical destination has been achieved. However, I have to tell you, Jack, it's hard to believe that your office is now a Starbucks. It's a beautiful Starbucks, but it's a Starbucks. Congratulations, Jack, and enjoy the following few minutes as you hear from many, many of your friends. So at this point, I'd like to raise a glass to our good friend, Jack. Jack, you've earned the respect of your peers and the admiration of your patients. Now is the time to more thoroughly enjoy time to be spent with your family and friends. Here's wishing you all life's best as you begin your retirement. Congratulations, Jack. Back to our good friend, Dan.
Thanks, Mike, Mary Sue, Carrie, great to see you. In 2021, we'll be able to see each other in person again, I'm sure of it. As you can see tonight, Jack has made a tremendous impact on so many people in the community. In fact, the foundation received so many wonderful notes. We had them compiled into this album so that you could be reminded of the many lives that you've touched.
We know Jack was a great doctor. We know he's a great philanthropist. But there's another Jack that we all know very well. Every spring, I would go into Jack's office as Kelly and I and the family prepare to go warm up somewhere tropical. And I would ask Jack, where are you and Kathleen headed after the ski season? And Jack would say, I'm going fishing with the boys in Montana. And a couple weeks later, I'd run into him and I would say, Jack, how was the trip? How was the fishing? How was the weather? He'd say, oh, it was rainy. It was pretty cold, pretty windy. I would say, how's the fishing? And he would say, some guys caught a few fish. And then he would get a sparkle in his eye and look at me and say, we had a great time. Because we all know Jack, the friend, best of all. And there's not many better than Jack at being a friend. So a toast to Jack, an incredible friend.
My special message for Jack is to thank him for saving my life when I was really in need. I'm sitting behind or in front of a painting that says, I say save me, somebody save me, anybody save me. And I chose to sit in front of this painting because I want Jack to know that he saved me when I was really, really sick 10 years ago and my endocrine system wasn't working and I was extremely depressed. Without Jack's help, we wouldn't have been able to find the care to get me alive and to get me well. And so Jack, my special message to you is thank you. Thank you.
All of us that really loved him, we knew that he was here with us always, and it just never stopped. So with all that in my back pocket, I'm thrilled to say thank you, Jack.
Jack, my hopes and dreams for you is that you can just look in the mirror every day and say, I've lived a good life, I've helped a lot of people, I've been a good husband, and I've been a good community leader.
Jack, I remember meeting you as a rookie on Vail Ski Patrol, and they warned us that you were going to hold us to a high medical standard, and you did. You inspired me to dedicate my career to emergency medical services, and you even wrote my letter of recommendation to paramedic school. 20 or so years later, it was an honor to serve on your 2015 Alpine Ski Championships Medical Committee, and an even greater honor to consider you as a close personal friend. Best of luck to you in your retirement.
Jack, I've loved knowing you through Steve, through my work at the Vail Valley Foundation, and working alongside you on the Vail Health Foundation board. You taught me great things can happen when the Vail Valley comes together for something that we care about. And you taught me that all you need is passion and a plan, and you humbly led the charge. Thank you for all that you've done.
Okay, Jack, I guess this is it. I'm glad I'm still here to say thank you for all the things you did for our family, and I hope you can live a long, long time with me and enjoy your life here, and you and Kathleen have a good time, and maybe we'll see you on the mountain.
There was, at one time, in the early 70s, very early, we were down valley, and there was a banner across the road saying, Eagle County needs a doctor. You know, we go back a long way, and I'm sure you're going to be so missed in that office. But maybe Kathleen will be able to see more of you, and good luck.
Thank you, Jack. Thanks for everything.
Thank you.
Jack, about a year ago, I remember you sending me a note of thanks for my work alongside you and in the community. Please know that I look upon you as a mentor and as a standard of excellence in all things. Thank you.
Hi, Jack. Congratulations on reaching this wonderful milestone in your life and your career. I love you very much, and you've always supported me. And I hope that in your retirement, you're going to get to spend more time with me. Love you.
He retired once and then he got bored. Or maybe his wife said, I think you better go out of the house more often, whatever. And now I think for him, it is time for him to retire and smell the roses, as like somebody says. And he's worked so hard and was committed not only to his business as a doctor, but also to his friends and their well-being. So therefore, I think for him to say now, look, I'm still there. I'm only a phone call away. And Chuck always will be only a phone call away. So he will retire, yes, physically, but mentally and with his heart he never will. Or we wouldn't let him. There's no way.
Then you got to remember what Shaika always tells you. When you toast, you have to look in the person's eyes.
Are you going first?
I'd like to propose a toast to Jack Eck, one of my oldest friends and one of the most respected people in Vail.
In today's world, friendship is a treasure, and it's rare. Thank you, Jack, for being our friend.
You're a true believer in the dream here, and you had a lot to do with making that dream come true.
Cheers.
Jack, it's an honor to pay tribute to you and to celebrate your many contributions to the Vail Valley.
Thank you for being a hero to so many in our valley and beyond.
Cheers.
Thank you.
We are so lucky to be here. We're here for many years of our life. We're going to be here for many more years of our life. I can't think of a more adventurous, more kinder, more helpful, more enjoyable place to just live life with our friends and people care about us and we care about them.
Thank you for the wonderful times, for the fun times, and we look forward to many more.
Right on, we
Cheers.
sure do. Cheers.
Jack, we love you and Kathleen. It's been an honor working with you, and we look forward to seeing you and Kathleen around town and on the mountains.
Thanks everyone for joining us tonight, and we'll see you in the new year in person.